Hello, I'm Nevmerzhitsky. I'm the legal coordinator of the European Prison Litigation Network, and I'm with Gennady Tokarev, the head of the Strategic Litigation Center at the Kharkiv Human Rights Protection Group, KHPG. And today we're going to speak about the execution of judgments that have been gathered in 5 groups of cases: Nevmerzhitsky, Yakovenko, Logvinenko, Isayev, and Melnik against Ukraine. These cases mainly concern violation of Article 3 due to condition of detention and overcrowding, inadequacy of medical care in prison, and lack of effective remedies in all these respects. It has to be mentioned that in January 2020, the European Court delivered a pilot judgment in the case Sukhachov against Ukraine, in which the court indicates that the government must take measures aimed at reducing overcrowding and improving conditions of detention, and introduce an effective remedy by 13 November 2021. But today we won't spend a lot of time on this issue of material conditions of detention, since the pilot judgment is quite recent and the picture it depends remains completely valid. We can only deplore the lack of consistent and comprehensive strategy of fighting overcrowding, and the fact that the policy conducted by the governments does not refer to the white paper of the Committee of Ministers on Prison Overcrowding. With regard to access to care in prison, even though the European courts have not so far made use of the pilot judgment procedure, it has nevertheless on several occasions stated that the poor quality of care in prison was a problem of a structural nature, and there was no effective remedies in this respect. And today in our presentation, we want to focus on this issue, since we consider that there is an extreme urgency in this matter, and this position is shared by the CPT, which in its last published report states that, I quote, "The situation observed in most of the establishments visited was such that it posed a considerable threat to the health and even life of prisoners." And when you will read our submission to the Committee of Ministers, you will see that the National Preventive Mechanism expressed its alarm on the fact that there was no improvement since the statement of the CPT, and that the Prosecutor General in January 2020 expressed his concern about an increase of 7% in the number of deaths in prison, which makes Ukraine very far ahead of Council of Europe member states when it comes to prison mortality. Therefore, today we want to send an urging message to the Committee of Ministers, which is to strengthen its attention to health issues in prison, and to separate the process of examination of groups of cases concerning access to healthcare in prison from those concerning poor conditions of detention. And indeed, the reforms that are required in these 2 areas involve very distinct types of policies, involve different actors, and follow different time frames. And in order to properly monitor this very large number of judgments, we consider that it's really necessary to clearly distinguish between the 2 types of issues. I will now outline the direction taken by the prison health policy by first stressing that the problem of access to care in Ukrainian prison is of considerable magnitude and of great complexity, and therefore would require really strong political will and clearly stated objectives. And instead, the prison health policy has been so far very confused. In 2017, the Ukrainian government adopted the objective of transferring prison medicine to the Ministry of Health. But in reality, the government limited itself to the creation of a new body, and which is under the supervision of the Ministry of Justice. And this reform was carried out in a way that was totally disjointed from the reform of the general health system that was ongoing at the same time. And due to lack of steering role for the Ministry of Health and the absence of in-depth reflection, the reform has led to an often chaotic situation, which has been really recently depicted by a report commissioned by the Office of the Council of Europe in Kyiv. And you will see the details of the assessment made by the Council of Europe regarding this reform in our submission. And so far, the direction taken by the policy is really confused, and we consider that it's highly problematic since, as the CPT stated in its last public report, I quote again, "It will be extremely difficult to address all the serious problems unless prison healthcare services are placed under the responsibility of the Ministry of Health." I will now give the floor to my colleague Gennady, who will briefly explain the variety of violation of Article 3 that we encounter in relation to health in Ukrainian prisons.
Hello to everyone. I am Gennady Tokarev from Ukrainian NGO Kharkiv Human Rights Protection Group. I am a lawyer and the head of Strategic Litigation Center. We are engaged in litigation for prisoners' rights both on domestic level and the European Court. I will continue the problematic raised by my colleague. First of all, I want to say that healthcare system facing with systemic and structural difficulties. Among them, general deficit of medical personnel in some institutions transforms to the full lack of medical care. Quite often medical manipulations, for example, injections or bandaging, are done by one inmate to other. Unavailability of methods of modern diagnostics and treatment in penitentiary institutions raised the need to refer the prisoners to the civil institutions, but mostly only scanty part of them can afford the service because the service general is paid. Medicines and medical supplies are procured centrally from health care center of the state criminal enforcement system through its regional offices, and in conjunction with the scarce budgeting is caused long delays in this provision. Transportation to penitentiary hospitals becomes a cruel testing for sick prisoners, and escorting them by a medical worker is a very rare exception. The next issue is the issue of management of infection diseases. The situation with regard to the management of infection diseases is particularly problematic given the weakness of specialized care, the under-resourcing of prisons, medicine, and the insalubrity of many institutions, particularly concerning hepatitis. There is no national program for detecting and treating hepatitis in Ukraine. Until now, there was no treatment from viral hepatitis C in Ukrainian penitentiary. HIV. The rate of HIV infection for the prison population is in 22 times higher than among the general population. Interruption of antiretroviral therapy is a quite typical situation. If HIV positive prisoner as well has opportunistic diseases, particularly tuberculosis, the necessity of changing of antiretroviral therapy scheme that requires inpatient examination leads to long breaks of the therapy. With regard to opioid substitution therapy, limitation of OST in the pretrial detention facilities with a 30 days period resulted to inadmissible quick detoxification and sometimes causes to death. Tuberculosis. A preventive medical examination that must be twice a year and always doing in practice. Again, there are no sufficient medicines for tuberculosis treatment. Inmates with open form of the disease placed at the same rooms with other prisoners, and it makes a high risk of contagion. Difficulties exacerbated by the COVID-19 issues. Inadequate medical conditions of detention, healthcare system problems, the lack of adequate funding, disregard for the need to release hardly sick convicts, and the inappropriate testing of the prison population is a serious threat to the penitentiary system, given the increase of the overall incidence of COVID-19 in Ukraine. However, the Ukrainian government refused to take actions to reduce the prisoner population on the issue of amnesty. Poor sanitary conditions in many of penitentiary institutions, negligence of administration of part of institutions to comply with epidemiology requirements, wearing masks, antiseptic treatment from side both the personnel and prisoners make the risk even higher. The information on COVID-19 situation in prisons cannot consider as reliable since the shortage of diagnostics. Transportation of the prisoners was stopped for several months, resulting to overcrowding of pretrial detention centers. Due to the quarantine, inmates were not transported to hospitals, and in some cases it has led to lethal outcomes. Thank you for attention.
Thank you, Gennady. Now I will complete our statement with a statement on our recommendations. We call on the Committee of Ministers to request the Ukrainian government to urgently file the vacancies for healthcare workers and the need of our equipment and medicine. Clarify as soon as possible the chain of responsibility within the medical units. Initiate, possibly in the form of a consensus conference, a transparent process for the transfer of prison medicine to the Ministry of Health, comprising national debates involving all the actors concerned, including civil society and international organization. We also call on the Committee of Ministers to separate the examination of group of cases concerning access to healthcare in prison from those concerning material conditions of detention, and to act with the Directorate General for Human Rights of the Council of Europe to ensure that prison health issues are given greater priority in the cooperation program, and find synergy with relevant European Union instruments to support the completion of the required process. Thank you very much.